Hello and welcome to this new episode of conversations about phalloplasty and metoidioplasty with Buck Angel, where this time we're answering your questions. We're speaking about feeling, sensation, as compared to phalloplasty with metoidioplasty, and we're speaking about clitoral growth, and we're speaking about masturbation, many different interesting topics. Enjoy. Hello, hello.
Hey,
Hi, Buck. How are you doing?
it's so good to see you, friend. How are we
Good to see you.
watching? It's so great.
Oh, that's true. I didn't see. Yeah. Nice.
Because we're
What does yours say?
oh this I think they're from Germany in Berlin, I think. I should connect with
Oh,
them. It's this t-shirt company. They sent me a whole bunch of cool. So real
ah,
quick, this right here, it's a really great story, and I'll say it real quick. But basically, I'll post more about it. But this was a group of artists and musicians in World War II. They created a fake illusion for the Nazis, where they created fake towns and fake so that they would trap the Nazis because they
ah.
bomb it, and then they would come in and bomb the Nazis. It was brilliant. Actually, they created
Whoa.
cities. It's so awesome.
Okay. I didn't know that.
Okay.
Yeah, mine says wild child.
Oh, that's you.
And Tantara, whatever that means. Actually, I have this t-shirt from it's all rainbowy, and that's why I got it. I really liked it.
Yeah, it's cool.
And I got it from California.
It's so
Uh,
California, dude.
yeah.
It's so LA.
Well, I think it was somewhere San Francisco, like or like the Bay Area.
Bay Area, LA.
Yeah.
It's very it's like hippie yoga.
Yes.
That's us here in LA. How are you?
Yeah.
How are you feeling? Are you recovering okay?
Well, yes, I am. I've started working this week,
Excellent.
and yes, but well, I don't know what's wrong. Like, is it my body? Is it the way they sue the doctors? But one suture, like there was like one space which is like this tiny little small, but it like just didn't like close, and it's still like open, but it's not really leaking or anything, but it's just not healed
So it's
the way it should.
is that what you're telling me? The sutures are not healing properly. How long has it been?
Like
How long?
one of them.
One.
Now it's since 21st of January, so
Oh, okay.
it's 2 weeks, 3 weeks,
3 weeks
less than 3 weeks.
time. That's not a long time. So
Yeah, I know.
what do you have to do now? What do they want you to do
Well, they told me to come again in about 1 week.
in 1 week? And then
Yeah.
healed, then what?
Well, all in all, it's if everything has healed, we can make another appointment to have the next, like, a second try for the erectile device.
Oh,
So for everybody who doesn't know, I had all the phalloplasty surgeries, and I had one try of an erectile device, but it got inflamed, so it had to be removed. And next time I can try, I need to wait until my body heals completely, and for that it needs to be like 3 months at least.
3 months. Yeah, but so during the 3 months, do they have you on antibiotics?
No, no, no. I'm off.
That's
I'm off.
great. That's very good.
Yes.
So now, so we have been talking. I don't want to be talking here. I want you to do it. So can you just
Cool.
recap all the, just real quick, recap what you've done,
Yes.
stage you're at?
Yes, exactly. So we have had 5 conversations with Buck here. So anybody who is new to this, check them out. They are on IGTV of Buck, and also on my YouTube channel, which is called Tea Time here, Tea Time. And we spoke about the 5 stages of phalloplasty in Germany, the way they do it in Germany. So the first stage is the vaginectomy, the removal of the vagina and closure, and the urethral lengthening. So to bring the urethral opening to the clitoris, which is also like a little bit elevated. And for that, they use the labia minora, and they close the labia majora and use them in the third stage to implant the testicles. And in the second stage, the actual phalloplasty occurs. So that's, in my case, from the arm, removal of the skin, rolling it in. And in the first stage, there was also a tube inserted into my forearm. There are two different approaches how to do the phalloplasty: the tube-in-tube method and the prelimination method. And I had the prelimination method. So I have a YouTube video on the comparison of the two methods. So if you want to check it out, you can.
Excellent.
And then the fourth stage is the erectile device. And the fifth stage is the glandsplasty. So it's the head of the penis.
Right.
And I had all five, but I got stuck sort of on the fourth stage, or like for me, I had the glandsplasty too, but now the erectile device needs to be, again, implanted. A new one next time when I heal.
So they had to remove the erectile device because you had some complications. Not a big deal. Not a big deal.
No.
Real simple. Then you take antibiotics, get the infection done. And now you have to rest 3 weeks or so.
3 months.
3 months until because they make sure you're totally healed up, right?
Yes, exactly.
And then you go.
Yes, exactly.
Surgery.
And yeah, exactly. So, and now we can speak about complications, but also we said that we will do the Q&A.
That's right.
Today, if you want, if people want, because
it's your floor. You're the teacher. I'm not. So
cool.
Yeah.
Okay. So I had two questions. I want to address them today because I promised to do that. And then I also saw that there were questions in the chat. So we can just address the questions and we just can talk because, this is how, because there's going to be topics anyway.
Right.
So the two questions were concerning the sensation, comparing the METOIDIOPLASTY and phalloplasty.
Right.
Because last time we spoke about METOIDIOPLASTY after we had explained the 5 stages. The METOIDIOPLASTY is it's a bottom surgery for people who don't want to have a transplant from their forearm or another piece of their body. And it's done similarly to the first stage, which I explained how was done with me. Vaginectomy and closure, and the penis is formed from your clitoris, and the urethral lengthening is also built from the labia minora. And the question was, sensation-wise, what's the difference? The difference is big. It's huge, because when you have a phallus made from your skin from another part of your body, this removed skin and attached to your body will primarily not feel anything, not at all. But what they can do is they take not only the skin, they take one branch of a nerve, which is a superficial nerve, and they connect it to one branch of the clitoris, also a nerve. And with time, and you really have to be patient there, really, you have to wait for at least 3 months. I had to wait for 5.5 months. And the surgeons say, you wait for 6 months, and then you can say if there is still no sensation, then you could worry. Then there is a reason to worry.
Okay.
But before 6 months, no reason to worry at all if you don't have any sensation yet.
Okay. Wow.
Okay. So
what I was waiting for, that's the next level. They're for sure going to get that. I knew that they were going to get sensation. It was connecting that one thing to the clitoris, that one, what's it called? Nerve. That's fascinating. That's the key to the best penis surgery right there, because you want to have sex and you want to have a sensation.
You want to have sensation, exactly. And the thing is that, when it starts, I like drawing. Okay, so I draw again.
Yep.
You have your clitoris here, and you have your phallus here, and then there is a nerve. You have a nerve here, and you have a second nerve here, basically, and there is a branch from that nerve, which is connected to one superficial nerve in your penis. So like when you wait for, let's say, oh, it's gonna be mirrored. Okay, I better don't write any letters
We get it. It
or
makes sense.
numbers.
It makes sense.
But okay, so like if you wait for 4 till 6 months, the sensation starts somewhere around here on the base of your penis.
Okay.
It's not that you like all of a sudden have the sensation everywhere.
That's right. Little by little, little by little.
Yeah.
That's right. Because
exactly. And then
let me say this real quick example. I don't know if anybody out there has ever had a sciatic nerve pinch, when you have a pinch of your nerve, and it's called sciatic, and it goes down your leg and it gets numb. But this to me kind of the same thing that's happening because the nerve is being, so the nerve, little by little grow. Oh dude, this is so amazing. Wow.
Yes, exactly. So you have to wait, and the sensation, it does come, but it comes slowly, gradually. It comes like weekly, maybe. It comes like up and up, like centimeter by centimeter, and then eventually it will arrive on the tip of your penis.
Okay.
But it is on one side. Okay, so if I go with my finger and touch on one side, just here, it feels like you are like taking a feather and going on your clitoris like this with a feather.
Wow.
That's how it feels. So
can you feel that now?
With time, you feel more. With time, you feel more and more.
But right,
and like if you
feel so you're feeling very light touch. Wow, dude, that's so awesome.
Yes. Now I can say now, 1.5 years later, I feel better. I feel more. It's not just like this line. It's like this portion. That's the whole side. Like I would say.
Yeah.
Like here.
That's right.
And also what's really fascinating is somebody is asking, feather like tickles. Not really like tickles. It's like fur. Like if you like take a fur or feather like and touch your face or your arm,
you can just kind of feel it like there, like that, right? But the fact you feel it is everything, dude. Everything. That is like so insanely progressive. Like by 10 years from now, dude, they'll just be transplanting penises like nothing, and you'll have a normal, regular penis. I
hope so. I hope so.
Do you have testicles right now? Are your testicles already implanted?
Yes. Well, one is also explanted. I just have one because when they implant the erectile device, they take out one testicle, and instead of the testicle, the pump goes in.
Right. That's right. Right. Because that's how you get the erect.
Remember?
Right.
Exactly.
Brilliant.
Exactly.
Brilliant. Really, I have to tell you again.
So
you really so much for sharing this knowledge with us, because I have to tell you, for many years I've been trying to find guys to talk about this, and only within secret groups would trans guys talk about their bottoms.
Well,
you know.
Well, they're actually YouTubers who speak about this quite openly.
Now.
Yeah. Yes. Now.
But because I am the man with the vagina, a lot of the surgery guys think I'm anti-bottom surgery when I'm clearly not. But I really...
I wouldn't think that. No, okay.
I really just want to say to you again how much I appreciate you, and how much people out there, I can see everybody appreciates you, dude. So,
thank you very much.
It's really a big deal that you're teaching this to us. And so I just wanted to throw that in there. So anyway, sorry.
Cool, thanks. So yes, with the sensation, it does get better. I thought that it's like that the nerve starts throwing new branches everywhere,
Right.
I hope that it's what it does.
Yes.
But what's really fascinating, and I didn't know anything about that before, is like your body, your brain, it just doesn't know that you have a new part, It's just that like you can see it, and then you touch it. Like if this is your penis, you touch it on the tip.
Yep.
And like, for example, on the side where the nerve is, so you actually feel something, but your brain thinks that you are touching your clitoris.
Oh, wow. Oh,
wow. Your brain doesn't understand that this is like, that it's now so big. And it takes time. And I think it takes years until the brain really understands and learns that this is your new body part.
Right.
And I think for me, sometimes, like when I touch and then I look, like first touching, then looking, then it looks, then the touching feels like, oh, okay, I just touched my penis, you know, like that. And then I look and I'm like, huh, what's there? Like it's like weird.
No,
it's weird.
I totally get it, because I can actually say, like, when I got my breasts removed, and they weren't big, I had, like, you know, that handful. And I think an actual thing with any human being that loses a limb or gain, you have this phantom thing. So phantom boobs. I was like, where are my boobs? Like, for years, it took me years to get used to being flat chested, right?
Yes.
Yeah.
Yes, absolutely. Same here. Absolutely. Absolutely. Yes. And sometimes I had, like, when I took my shirt off, like, really fast.
Yeah.
I felt like, oh, I'm like naked now. You know, this sensation, this feeling.
That's right. Like you're not supposed to be naked.
Exactly. But now I think now it's gone. Like 5 years top surgery for me.
Yeah.
Yes.
Yeah.
So for sensation wise again, now I think I'm feeling my brain starts to learn that I actually have a penis, and like when I touch somewhere here, it's just an awesome sensation. It's an erotic sensation, and I learned to understand that it's really my penis and not my enlarged, like, huge clitoris, you know.
Right. No, totally. I had to get my head around my clitoris, right? That's how I became so comfortable. I just immediately said it's my penis, and my penis is that big.
I know, which is cool.
Disconnected that. Luckily for me, it worked. I mean, it doesn't work for everybody. A lot of guys really need to have the bottom surgery, and that's and awesome. We need to understand there are options for all of us. All of us. There is no right way to be trans. There's no, you know, there are variations. We're variations of humans, and the great thing about us is that we get to create our own space. If you don't want to have a penis, don't have one. If you want to have one, if you don't want to have boobs, I mean, it's actually pretty amazing. What I don't understand is the pressure we put on ourselves here in this community to sort of conform, when that's the whole point. Is we don't have to conform. We can be whoever we want to be. So
that's true.
It is true. And I think it's really a misconception that we give in our community, that we have to conform to this idea. I'm a medical transition person. So are you. And this is what we choose to do. There are non-medical transitioning guys.
Oh, yeah.
Dude, go for it. But we don't need to be clashing with each other, which I don't understand. The clash.
Yes, I totally agree. I mean, like, if you can get your head around your, like, your body, like you are, like saying the clitoris is the penis, then it's fine, right? Like, for me, it was really important to be able to pee standing up.
Right.
It's just something I always wanted, like, my whole life long. And now I can, and I'm really, really happy. So, you know.
That's so awesome, dude. No, that's exactly the point. I think everybody out here needs to hear what Demi and I are saying. We have different ideas of what we need to be men, and that's okay. And me and him respect each other's choices of how we need to be men. That is what I want. Why I love that you can come on here with me, because we need to show the rest of the community. Me and you don't agree on everything, but we love each other. We care. Our messages need to be put out there, because if my story and your story, which is totally different. I grew up in America. You grew up in Russia. We have totally different FTM stories, which are so important. Even from this state to the next state, the guys are doing different things. And also, people remember, cisgender men are all different.
Oh, yes. Absolutely. Yes, absolutely. And, you know, there are many cisgender men who don't pee standing up or not at the urinal. They want to go to the toilet.
No,
cabin.
A boyfriend who doesn't stand, he doesn't stand. He always sits and pees. That's the thing that people need. There's a many cisgender men who go, I don't stand, I sit. Why would I stand? I get to sit. And I'm just like,
yeah.
That's great.
Exactly. Yes. So let's get to another question somebody asked. Just the sensation again, just one more thing. If you have metoidioplasty, you will have full sensation, just the way it was before. Like, you will have to give yourself, your body, time to heal, because I mean, of course, if you have like a scar tissue there, it's gonna take time to heal. But your penis is going to feel everything the way it was before, maybe even more, because they take out some skin which was covering it before. What you also have to know that if you choose to close the vaginal opening, then well, of course, you won't be feeling that area anymore. Of course, you can't have penetrative sex anymore.
Yeah.
Anal sex you can,
Yeah.
but the vaginal sex is not possible.
Right.
So you're not gonna feel that, but you will feel like oral sex will be really enjoyable for you, which is not possible anymore with phalloplasty. Like
wait, repeat that. What isn't oral?
The sensation oral.
So you can have
oral sex,
but you can have.
You can. Yes, but you can't. You're not gonna feel it the way it was before.
Okay, it's different. Have you had? I mean, I don't know. Is that too personal a question? Maybe.
All good.
So okay, so are you masturbating right now?
Yeah.
And does it feel pretty good?
Yeah. Yes, it does. Like you can there are different types, like ways how you can do it with phalloplasty.
Yeah.
You can just just go over your skin.
Excellent.
With your hand, or you can actually really grab your penis and just do the up and down movement,
right?
Which is really amazing, because you're pulling on the nerve here, which is pulling on there, on the basis.
Wow.
Yes.
Wow.
So what does not work is cis penis. You can't really move your skin, and you don't have a shaft.
That's right.
Along which you will move your skin, unless when I have the erectile device, maybe then it will be like that. I don't have experience now.
So now you have no erectile
no
thing inside it.
Implant.
So now is it just sort of like a penis that's not erect? Is that kind of what it is? So it's and so
it's just skin. It's just skin, very, very soft.
It's just very, very soft. So yeah, it's a flaccid penis, basically, right?
Yes.
So I guess my next question is, do you think that me and you should discuss creating a product there that men who have penises can masturbate with them? Because there isn't something. Maybe we can really cool masturbation product for.
What we really can do is, and I'm now waiting for a product to arrive from actually Russia,
okay.
I think.
Okay.
They were ordering it at some other country, but I didn't have an option to order it for some reason.
Yeah.
Anyway, it is a silicone kind of
a cylinder
thing to. It's like a super thick condom. That's what you can think about. You have something like that.
Yeah. I mean, you know me. Well, you know me, dude.
Bach has everything.
Creating. I'm always creating. I can't help myself. I'm always creating because I love.
Awesome.
So maybe something like this.
That looks very soft, but yes,
And what you do is you stick this over top of your penis, right? And then your penis goes inside of it, and you roll it down. So now, look how flat. But you can now go like this, but it has ridges on the inside. And then when you're done with it, you can throw it out if you don't want to use it anymore. It's a posable jack off toy.
Okay. This looks really good. But what I'm speaking about is just like this, but make it thicker. Like, I don't know, 1 centimeter thick or something.
Okay, yeah.
Like a third of an inch.
This is pretty. See how thick it is? So look how thick it is. It's way thicker than but you think it should be like that thick? Like that? It
should be thicker, even thicker, because it needs to be, or maybe you can make it the way that it's harder, that it's erect. It makes the penis erect.
Harder. So maybe like this size, but hard. Like this. Like the buck off, right? So the buck off is hard. But see, I want to make something for guys who have a penis. But you know what?
Yeah.
Cisgender men buy this. And I call it knob polisher. So they just put it of their penis but see how thick this one is?
But can you roll it together? Ah,
Yeah,
that looks good.
I'll send you a bunch of stuff, and I want you to practice with it, and then
Okay,
okay, and then we can.
that'd be cool.
Yeah,
That'd be cool. What I'm waiting for,
yeah,
what I'm waiting for now is something like what you showed, the black one,
yeah.
but it's bigger. It's like twice as long,
Right.
and the idea is to have sex with that.
That's right.
It's not for just masturbation.
That's right.
It's for having sex, so it's hard, so you can penetrate.
That's right. That's exactly right. So this actually could be. This is also made to have sex too, but in a way because the inside has ribs. So when you're
nice,
right, it's doing that, but it's kind of like like that. But at the same time, then you could just throw it out. But that I like the idea of it being harder. Then you can stick your fallow in there, and then you can penetrate somebody. That's an excellent idea.
It's just that super important that it's that you are able to roll it together like a condom, because the phalloplasty penis without the erectile device is like super soft. It's so soft. You're not gonna be able to put it anywhere.
That's right.
It's gonna be like, you know, like, no, I'm not getting in there now. Really, it's exactly. You really have to like take it and then roll it over like how do you call it? Like a condom?
Yeah, no. I think
that's comparison.
A little harder. I think I totally get what you're saying, and I think it's an excellent idea. So anyway, we'll definitely.
Okay, cool.
Yeah.
Okay.
Yeah.
So then I will answer one more question, and then we see how it goes.
Yeah.
There was a really, really interesting question, which was interesting for me before I got the phalloplasty as well. Somebody asked me if they can get phalloplasty if they are just like 1 or 2 months on T. Like we all know that the clitoris is growing on T, and the question is like, is it gonna grow inside too, or is the phalloplasty gonna disturb the growth? This growth?
Question. Great question.
It is great. Yes, exactly. So I think it is not a problem at all to have phalloplasty whenever you want. Like even like you could have it like without T probably, but it's just difficult to have if your clitoris didn't grow much. It's gonna be difficult to like put it up, you know, to elevate it much, because there's not much to work with. But the phalloplasty is not ever going to disturb your clitoral growth.
Keep going.
Somebody came?
No. I want to grab something. Just go. Keep.
Okay.
Yeah.
So the phalloplasty is not going to disturb your clitoral growth because, and this is something I didn't know, because the clitoris is not inside the penis. I thought they take the clitoris and wrap your skin around.
Right.
So that like when you do this movement, you like basically like masturbating with your clitoris.
That's right.
But that's not how it is. It isn't. It's like, here's your body.
Yeah.
The clitoris is here.
Yeah.
And the phalloplasty is going to be somewhere like here.
Oh, wow.
Really? So that the clitoris is somewhere between. It's on the basis of the penis, but it's somewhere between the penis and the testicles.
Testicles, right. So it's under.
So if it grows, yes, it's somewhere in between. So if it grows, it can grow. There is like everywhere skin, and the skin is soft, so it's not going to disturb the growth.
That's right. And I think the way our clitorises grow, they kind of grow fatter. Not necessarily. I mean, they do grow long to get an erection, but I think it's well, and everyone is different. Please say that.
Oh yes.
Everyone is different. We can't compare each other. It's like cisgender men. Their penises are different.
Oh yeah. Absolutely.
We cannot compare each other's growth. You know, I have this model vagina that I use a lot for, which is great because, you know, we can't show vaginas for some for some reason.
For some reason.
It's so weird, dude. But anyways, the clitoris usually a lot of times on norm, you know, for lack of a better expression, for biological women, the clitoris, you know, is usually kind of small, right? It's usually like that. So if you didn't have surgery, right, and you got the thing, even if you choose not to do testosterone, it would just stay that way. And I don't know why you couldn't have surgery even if you don't use testosterone. I mean, it's an excellent question, but they connect because of the clitoris being so small. Could they actually connect a nerve ending Because
I'm sure they can. I'm sure they can. They will remove some skin. They will like they will get to the nerve. They're surgeons. They can do that.
that's right. That's amazing. So really, anyone, even a non-binary person who's not on hormones and isn't doing living as a man but wants to get a penis could totally do that, right?
Not with my surgeons, but I think like it is possible.
So tell me,
My surgeons,
what's the
they will. Their names are Küncher and Bull in Berlin.
but what are the prerequisite, I guess is the word I'm looking for.
For them, yes,
Yeah, to be
they insist that the patients have they have the in Germany the diagnosis that they got the diagnosis in Germany, and that they have like two what they say, the medical
letters from do you need
two letters from psychiatrists,
yes,
from German psychiatrists. It must be from here.
Well, I'm going to tell you that I agree with that. I'm kind of old school that way, but I think that doing something so drastic as getting a penis on, you need to have serious understanding of the consequences, not only that,
Exactly.
of your life. So personally, I don't find that gatekeeping. Personally, I find that sort of safekeeping and making sure you're creating the right choice, because you don't want to put a penis on and then 5 years later you're like,
yeah, exactly.
Yeah, not cool.
Yeah, but what you said earlier, it totally makes sense. Like there are people there who are non-binary and who, for example, don't want testosterone, but maybe want a penis. Why not? I mean,
I don't give a, I mean, why do you care? It's not, and that's why does anybody care?
Exactly.
Adults. I don't care what any adult does with two.
Yeah.
It's your your body. Make what you want. Children, I have a different opinion about that, and that's just me.
Exactly.
Older, and I don't even know if it has to do with my age. It just has to do with me. I think really understanding my own transition. Oh, really, I've never looked back, and how important it is for people to be in that mindset for medical transitioning. I don't care about identity transitioning. Medical transitioning needs a lot of layers there. I really do believe that. I mean, you're so centered and so grounded, and I think you took those steps. Did you go to mental health?
Well, did. I went to see a psychologist, a psychotherapist for 2 years.
Excellent.
I needed that. I really wanted that. But I was 30. So by the time I was 32, that's when I said, okay, now I will start.
See, and I don't know. I mean, maybe I'm not saying like you have to do it or you can't change. I just think people should think about doing it prior to transitioning, because I'm going to tell you, it helps you so much. It's like,
oh yes,
it gives you so much. And what?
Absolutely.
Why wouldn't you do it? That's the thing that I don't understand. Maybe it's not accessible.
Yeah.
Okay, to all the kids out there, everyone out there, if you can't find a therapist, you send me a direct message or DM me maybe. But I'm connected to a lot of mental health care in this country. So if you can't find a therapist, you contact me and I will do everything I do to help you get a therapist. Because I don't want you to have that excuse of, Buck, I couldn't find a therapist. That's an excuse.
Exactly.
And there are
and I would like to ask you, like, if it's in the States, if somebody is looking for a therapist, do they do that just for themselves, or do they need to do that so that they get the diagnosis?
That's right. It's different from state to state. So here we have state, and so each state has its own laws. So it's not federally governed. If it was federally governed, then yeah, that's tough. But each state gets to create its own laws around trans surgery, trans health, trans. You know, now we have what's called self-ID, which I'm not 100% okay with, especially when it comes to medical transitioning. I think self-ID is fine for anyone who's just going to socially transition. But to medically transition, I think we need mental health attached to hormones, surgery, moving forward.
Yeah.
Don't believe that.
Okay.
Okay.
Because like I'm asking because if there are people like looking for somebody, for a therapist, for just themselves, to understand themselves better, then I can offer my help because I'm a life coach.
That's right.
But I wouldn't be able to write like a letter, like letter, which is a
that Demi,
psychiatrist can write.
he's a life coach, and he really is a great guy, and he lives his life like you're just not doing the tranny thing. You're totally living your life and moving forward, and it's why I really respect you a lot. And
I'm married and we have a kid.
Sorry?
So I'm married and we have a kid together. So like we're just a normal family.
That's right. That's what I want the world to see. I really want the world to see guys like us. Just we live our lives. We don't want to cause, we want to be part of I want to be a part of the world.
Oh yeah.
I don't want to be in the trans bubble. I want to be like, creating for the world. It's so that we actually get back into the world. So whatever it takes for anybody out there to get back in the world, create that space to get it. Maybe for you, Demi, it was getting your penis, and now that's going to be the thing that makes you feel whole, and you'll be able to walk the world as a whole man. Right? Yeah.
Yes, absolutely. I mean, like, it's been a journey for me anyway, and if I didn't have the option, like I'm sometimes asked, like, would you have done this surgery if you didn't have the means for that, or if you didn't live in Germany and stuff? I always say, if I weren't living in Germany, of course or in Russia, if I was still in Russia, I wouldn't get the surgery, because it's just not possible there. It's mean that I wouldn't, or it doesn't mean that I wouldn't be happy with what I have.
That's right.
I think I would be then like you. I would be trying to embrace the way I am and just own it. Just, this is the way I am now.
That's right.
But because it's possible in Germany, and because the insurance is covering this, why not? Why not try and do this? It's better to do it than not to do it if it's possible.
Well, it's possible. That's exactly right. So for me, it wasn't possible 25 years ago. It just was not possible. It wasn't going to happen. I didn't like what I saw as the results, like all of it. It just was not my choice.
Yes.
And it doesn't mean we have to beat each other up over it. That's the other thing.
No.
Understand levels of acceptance, levels of what we want to do. Who knows if I was you today, I would probably get a penis, to be honest with you. I probably do exactly what you did, because the opportunity is there for me.
Somebody wrote, like, did they if I knew about the complications, if they told me about the complications, and my answer is I didn't have to be told about complications. I was looking for them. I wanted to know what are the complications.
Yes.
And I wanted to know that about all the countries, what kind of complications do there exist, and what would they do if something like this happens. And then I went to my surgeons and I asked them, how many complications, what are the rates with your complications? What do you do if you have this or that complication? And if you want, we can talk next time about complications.
Yes, for sure.
But this is really, really important to be informed, because you go and let yourself be cut up.
You're doing a lot of work for these guys. Seriously, you're really being very generous with your time, and also you're being very generous with all the stuff that you taught yourself. And so you're giving back that information. That is so big, because now the guys don't have to go digging. Like, literally, just go to Demi's YouTube channel, go to his Instagram, go to his Twitter, go to all of it. All the information is there, and also he's accessible to you. He will help you find that place to go. So that's all I ask for from people in this community. If you don't want to be part of it, an activist, and you feel like you don't need to educate, which is a weird thing I hear in this community. Someone called it emotional labor. I was like, what? They said, I'm not educating cisgender people. That's emotional labor. I'm like, wait a minute.
Okay. Well, I haven't heard of that yet, but I think, well, I think if it's like, of course, it's not my job to educate cisgender people, but if somebody is asking and I'm accessible, I would. But I also understand, like, somebody doesn't want to educate some people. But emotional labor sounds interesting.
But do not say it is not my job to educate, because on some level, it's all of our job to make sure that the world sees us in a way that we want. So when people yell at me for me educating, don't yell at me. Educate the way you want to educate. Like,
That's true.
can't say I'm not going to educate and then don't like the other people who are educating.
Yeah, what I like concerning that is like there was somebody wrote like as a comment on YouTube, don't hate, create.
Yes,
and I love that.
that's excellent.
Exactly. If you don't like what we do, don't hate on us, just create something better.
I mean, I just find
Right?
it's a very, I don't know about over in Berlin and stuff, but there's a very privileged attitude these days within this community. This idea that you don't need to educate, this idea that it's not my job, this idea that everyone should already know about us. Nobody knows.
Yeah, that I don't agree with. No.
I don't.
The last one. Yes.
So the people who don't just can go over there. Me and you will. So let's. I gotta go. So how about if you recap where everybody can find you and where everybody can follow you?
Yes, you can find me on Tea Time Coach. I'll just write it one more time.
Yep, please.
Tea Time
Coach.
Tea Time underscore Coach.
Thank you. And you
like this.
Excellent.
And my YouTube is just Tea Time. Just Tea, but like no underscore, just Tea space time. That's my YouTube. And please just write me messages about what you want to know. Like if you want me to make a video, because I have really many videos, but many of them are in Russian.
Okay.
And I will make YouTube videos which are in English gladly.
Excellent.
Just ask me.
Yeah, so just ask him. He's so willing to give his time and energy. And Dimi's an awesome person in our community who's willing to educate.
Thank you, Buck, for the platform. Because I don't have so many followers yet. I have just started my Instagram.
It's not about the followers. I want to just tell you something right now, kiddo.
That's true.
Quality. All your followers are quality. They're not bought. They're not these people. They're all your followers. Remember that. All my followers, I don't have a lot of followers. They're just the people who want to hear from me. And I want quality. I don't give a shit about 5 million followers. I want people who are wanting to listen to me and hear me and have conversation. And that's what you have. You have quality, dude. Remember that.
Thank you. Thank you. Awesome.
Yourself, and let's connect. Next week, we'll have a new one, okay?
Yeah. Cool. Cool. Awesome. Have a good day.
Yeah, you too, my friend. Bye.
Bye-bye.